State Representative Kristina Shelton from Greenbay says it's all hands in the kitchen when it comes to the Wisconsin Healthy School Meals for All Act.
This legislation puts forward a plan that will provide a free, healthy school breakfast and lunch, that's 2 meals a day, for all Wisconsin kids with no eligibility requirements. It will ensure that we maximize federal reimbursements for school meals and ensures that no child in Wisconsin has to worry about missing school breakfast or lunch because their family can't afford it.
The bill would apply to all schools across Wisconsin.
Kids who have to experience hunger do not learn, and they're worried about where they're going to get their next meal. When we want to educate the whole child, we have to take into consideration these needs. Ending the stigma is a big part of that.
Shelton says she doesn't know the cost of the investment yet, but says they should in the next upcoming weeks. According to Feeding America Eastern Wisconsin, the organization is seeing a 29% increase in childhood hunger compared to pre-pandemic times.
Why is right now such an important time to do this?
That's a great question. I think with the COVID pandemic, if there was a silver lining, what it did was it highlighted the pervasive inequities that we as a society and in the state of Wisconsin were already facing, and that includes food insecurity and hunger.
Lawmakers introducing this piece of legislation are calling it a win-win. They say it benefits kids in schools and our local farmers.
It will end student meal debt. It will end the stigma of school meal participation. It will invest in the localized food system, in farmers and in growers.
Now, are you worried about what we are seeing right now as a community, what we're hearing?
Yeah, clearly this is a very challenging time for us as healthcare providers trying to deliver care to people who both have COVID and don't have COVID. Right now in northeastern Wisconsin, the Fox Valley and north central Wisconsin, the last time WHA had reported, that's the Wisconsin Hospital Association, we had just one ICU bed available. In northeastern Wisconsin, we have 38 people in the intensive care unit with COVID-19. And clearly this is putting a significant stress on our health system as we try to deliver care and give people seamless transition from emergency departments or being at your home to being hospitalized. There's a bit of a delay, and people aren't having as good as experience as we would like them to have.
Let's talk about breakthrough cases. What are you seeing currently with that?
So with breakthrough cases, it's relatively rare at this point. People might not realize right now in our hospital, about 1 in 4 people who are admitted to the hospital are either infected with COVID-19 or are no longer actively infected with it, but are still recovering from their recent infection of COVID-19. So, it's greater than 25% of people who are in the hospital are there due to COVID-19. Breakthrough cases make up a very small number of those people. Right now, about 1/3 of people in our local community at this point have chosen not to be vaccinated if they're an adult. Yet in the hospital, they make up 70 to 75% of people typically who are hospitalized. And commonly, our ICU will be only people who are unvaccinated, plus or minus 1 or 2 people who may require ICU care. So the breakthrough cases are relatively rare. We see a clear preference for COVID to make people who are unvaccinated very sick. And, it's stressing our health system, our ability to deliver that care to everyone as seamlessly as we would like to.
Hearing a lot about boosters, what advice do you have for someone who is eligible to get the booster, but they're putting it off?
First, I'm happy that they received those first 2 shots. Even though we do see some waning of immunity over time, most people, unless they're immunocompromised, continue to have some degree of a protective factor against COVID-19. When we look at studies, there's about 5 times as many people who are unvaccinated who get infected with COVID-19 on a per capita basis. It's 11 times higher for them to be hospitalized, and it's 15 times higher for there to be a death in that unvaccinated group compared to that vaccinated group, regardless of booster status. And, the evidence is suggesting that if you get that booster, you're only improving your health and your ability for your body to fight off getting infected in the first place, needing to be hospitalized and dying even more. We have a very high case burden right now. Our positivity rate is increasing, and our experience through this whole pandemic so far has been that when that positivity rate starts to increase, more people seem to get infected over the short term, and then there's a delay where more people end up in the hospital, and then finally more people die. So we're sort of in a challenging situation right now going into the holidays, and we know that our strongest way to prevent this from getting worse is to, number one, talk to people about considering getting the vaccine if they're unvaccinated, and number two, getting those booster shots for people who are vaccinated. And the time really is now to get that shot done. And then we do see influenza cases starting to pop up in Wisconsin. We lag a little bit with influenza as well. So it's a great time now to get an influenza vaccine as well.
Let's talk about kids. According to the CDC, more than 1 million kids ages 5 to 11 have received at least one dose of the vaccine. What kind of numbers are we seeing in Northeast Wisconsin?
I think we're seeing fantastic pickup. That measure is not yet reported out in the state's data, so I don't have an exact number for you. I know it's been hundreds, it could be approaching 1,000 at this point of kids that we've seen, at least locally with us, who have been vaccinated, but we're making very strong progress there as well. And, the one point that makes us optimistic as health care providers is about 4 to 5% of the Wisconsin population is in that newly eligible age group. And that may be very well what gets us towards that tipping point where we have stronger herd immunity. Right now our hospitals are maxed out. I hear a lot of people say that natural immunity is better. If we were to allow everyone to get natural immunity, millions of more people in the United States would have died from COVID-19, and we don't have capacity to care for more people to let this natural immunity happen. So that's really not an option in my eyes.
Doctor, we're less than a week away from Thanksgiving. I know you had mentioned it a little bit before about, gathering for the holidays. What do you say to people out there still contemplating? Maybe they'll have a large crowd. What do you say to them? Any safety advice as well?
Yeah, I think I've talked about vaccination enough at this point. So aside from getting vaccinated, I think the most common thing talking to patients would be that if you feel like you have a sinus infection, you have just a cold, or your allergies are acting up, I would not go to a Thanksgiving gathering of any size. I've seen many patients come to the emergency department who sometimes ask just for antibiotics for their sinus infection. And most commonly at this point, it ends up being COVID-19. The symptoms of a sinus infection and COVID-19 are essentially the same, and it's only really possible to differentiate the two if you have a COVID test that's done. So that's my number one advice. If you're sick, don't go to any gatherings. And then, of course, just be smart. Like, the smaller the gathering, the better. The more vaccinated people in your group, the better. And if you're going to be in a group, a large setting, particularly if you don't know these people, wearing a mask when you're close together has been shown to be effective at mitigating the spread of COVID.
Rental car prices skyrocketed in the summer as a result of rental car companies experiencing a shortage of vehicles and high demand. More vehicles have since been brought in, but as more people get ready to get on the road again for Thanksgiving and winter holidays, rates are again on the rise.
Holiday travel like this isn't as big for rental cars, but we're still seeing about a 5% increase in costs this year compared to last year.
AAA predicts there will be nearly 4 million more people traveling in cars this year from last year nationwide. In Wisconsin, they forecast 63,000 more drivers will be hitting the road.
We're expecting a lot more people to be traveling this year compared to last year. Not quite back up yet to pre-pandemic levels of travel, still about 4 or 5% fewer travelers than 2019, but obviously very close.
As for car rentals, AAA says we can expect to see an average daily car rental rate of $98 over Thanksgiving. That's up about 5% from last year, but 31% higher than 2019. So if you're planning to get yourself behind the wheel of a rental car this holiday, book early.
We would urge anyone who does plan on renting a car or is interested in renting a car for their holiday travels to do it as soon as possible. They make that reservation, just because inventories are still tight with automakers, and that is trickling down to the rental car companies.
Gas prices are also spiking, especially ahead of the holidays.
The increase in demand may push prices up a few cents as we go into the holiday weekend. Obviously this is sort of a temporary increase in demand for the holiday weekend. That's not going to have a long-term impact on gas prices.
Prices associated to travel across the board may be on the up and up, but
people are still going to get together and travel to see their family.